during the 5th week in the wall of the truncus arteriosus and the bulbus cordis, one pair of ridges appear, called conotruncal ridges. As these two ridges occur, they undergo a 180-degree spiraling and approach with each other, and ultimately they fuse with each other and form a spiral aortical pulmonary septum, which divides the truncus into an aortic and pulmonary channel. Because of the spiraling of the aortical pulmonary septum, the pulmonary trunk twists around the ascending aorta just like this. It has been reported that neurocrest cells migrate through the bronchial arch to reach these regions. Abnormal migration, proliferation, or differentiation of neurocrest cells results in congenital malformations in this region, such as tetralogy of Fallot. Since neurocrest cells also contribute to the craniofacial development, it's very common to see facial and cardiac malformations in the same individual. Abnormal septal formation in the truncus arteriosus will cause severe malformations. If the aortical pulmonary septum fails to develop and divide the truncus arteriosus into the aorta and pulmonary trunk, persistent truncus arteriosus forms. Since conotruncal ridge also participates in the formation of the interventricular septum, the persistent truncus arteriosus is always accompanied by ventricular septal defect. The undivided atrial trunk overrides both ventricles. Thus, the pulmonary and the systematic circulation can't be separated with each other, which will cause severe hypoxia. This congenital malformation is very common in DiGeorge syndrome. If the aortical pulmonary septum fails to follow its normal spiral course and runs straight down, transposition of great arteries forms. Transposition of great arteries is the most common cause of the cyanotic heart disease. The aorta arises from the right ventricle and the pulmonary artery arises from the left ventricle. And let's check the circulation pathway. Deoxygenated systematic venous blood returning to the right atrium enters the right ventricle and then passes to the body through the aorta. Oxygenated pulmonary blood passes through the left ventricle back into the pulmonary circulation. Thus, highly oxygenated blood never enter the systematic circulation. These infants usually die within a few months. If the aortical pulmonary septum fails to divide the truncus arteriosus equally, aortic or pulmonary stenosis forms, in which pulmonary stenosis is common, which is followed by 3 cardiac defects. And here shows the pulmonary stenosis. Since the conotruncal ridges also participate in the formation of the membranous parts of the interventricular septum, abnormal development of the conotruncal ridges also cause the ventricular septal defect. In addition, the pulmonary stenosis also causes an overriding aorta that arises directly above the ventricular septal defect. Because of the left to right shunt, the right ventricle gradually becomes hypertrophy. Pulmonary stenosis, interventricular septal defect, overriding aorta, and hypertrophy of the right ventricle. These 4 accompanying symptoms are called tetralogy of Fallot. Cyanosis is one of the obvious symptoms of the tetralogy of Fallot. Echocardiography is used for the diagnosis of tetralogy of Fallot. Most patients have cardiac repair surgery in the first year of life. Septal defect is closed with patch, and the right ventricle outflow tract is enlarged. Repair surgery of these 2 defects resolve the problems with the other 2 defects. Well, this is the partitioning of the truncus arteriosus and bulbus cordis and clinical correlations. Now, share one case. A child is born with severe craniofacial defects and transposition of great vessels,
what cell population may play a role in both abnormalities and what type of insult might have produced this defect. Please leave your comments in the discussion area. Thanks for listening. See you next time.